Thank you very much for the opportunity to talk today. And yes, I do get involved in a few projects. So Tangerine Bee is a business that I've had for 8 years and really has specialised in healthcare. But in terms of data, we don't see it as just healthcare. I'm also involved in running a social enterprise that focuses on helping young people who are trying to enter the knowledge sector. So this is an area that is very important, and I think more and more so. We've already heard that the knowledge economy is here and is going to continue, and I don't think we're paying enough attention at the moment on how we are bringing people into the economy and planning for the future. So in planning for the future, I'll take you into global health workforce issues. At the time I entered this, one of the issues was to do with big data. So I entered this about a decade ago thinking, this must be easy because you get the Excel spreadsheets in an email, so it's not big data. We're not worrying about big data. But actually, it's not that it's easy because it's small numbers. You only get a few lines. Maybe you get 50,000 lines because you get workforce data. In the UK, we publish this data every year as annual census. We publish it every month. We know every month the workforce that's here. But actually, the issues are more to do with the complexity of getting the numbers into policy. And that's where workforce planning can really make a difference. So it's a very small issue, really, in terms of data and numbers, a very massive issue in terms of impact. And the reason it's a massive issue in terms of impact is because if we get this wrong, we've got about a 10-year period sometimes in some of our knowledge workers, in some of our medical, nursing, physiotherapists, when we have to train them to the level of expertise they need to be able to save our lives or help us, it can take 5 to 10 years. So when we talk about a shortage, we don't talk about something we can fix very quickly. And that's why planning becomes an essential part of this. And in planning, we can think about planning as qualitative. We've already heard about how qualitative information is important. But we can also think about it as quantitative and projection models. And that's kind of where we get involved a little bit. So data comes into the picture, and it needs some work so that someone can make a decision with it. So I thought I'd take you through one of the examples that I use. I'm also a part-time PhD at London School of Hygiene and Tropical Medicine, and this is my topic for the PhD. So the idea here is that we have people who die at childbirth, essentially, who don't need to be dying. A majority of that is happening in developing economies, where the resources aren't there. And the resources I'm talking about are currently called skilled birth attendants. In the UK, that's midwives, obstetricians, to you and me. So in 49 of the countries where majority of us, when we give birth, have some assistance, there are about 58 countries that have been labelled as high priority in this world. And in that, 18 of those countries, very few actually get help when they're giving birth. So this is a life-saving issue. As we plan for this issue, as we plan for this workforce, we can't actually magic them up very readily. And it costs a lot to magic them up. So it can take 5 years, it can take millions of dollars when we actually need to be focusing that in priority areas today. Somewhere along the line, someone has to put the voice up and say, actually, we need to train these guys up for 5 years' time, for 10 years' time, for 20 years' time. And so analysis makes this possible. And you look at analysis and you start to highlight some possibilities, some risks for not training them, some risks for not putting money into salaries in the future, in the near future, in the long-term future, to think about this workforce. And if I just go over the key concepts, workforce planning itself is a very, very simple process. You work out how many you need in the future, you work out what supply is coming in, and there's a gap, and you find some solutions. Solutions are usually in migration. We've all heard about the influx of doctors, nurses, etc. into the NHS system. That was partly a solution for the gap that existed. Or you can train them up and plan a few years ahead to make sure the training is in place. So technically speaking, it's a very simple concept. And it's not that we're in our infancy either. So this shortage that you talk about for workforce is actually a shortage that we know how to address if we do the right analysis. But so in many ways, it's there. The setup is there, the technique is there. So what's going wrong? Well, as with any area, we can have the critiques. And the criticisms around workforce planning, of what we think is going wrong, are to do, for example, with uncertainty. So uncertainty comes in when you think of workforce numbers. You can't pinpoint, at the time you're doing your planning, you can't pinpoint a workforce number. Even in the UK, as we count the workforce, there will be differing numbers, whether you go to the Royal Colleges or whether you go to the NHS or you include private sector, exclude them. All this needs transparency. And as modelers, we're not getting that totally right. We take one number, we project to the future, and somehow we don't give the message that we're really not clear on some of the areas that we're modelling. Health is also team-based. So healthcare delivery, as we do it at the moment for modelling and projections, we take a profession, we model it through, leave out everybody else in the picture. This happened for cardiologists. We model that through. The cardiac physiologists we needed, who were their scientific arm, did not exist. The service could not be delivered. So we don't always do that right either. And then there's the curse of the averages, which is a big problem if you look at Millennium Development Goals. Millennium Development Goals are coming to its head 2015. We're supposed to be reaching some goals where we can say, actually, we've improved health, we've improved people's lives. What we're finding is we've improved health in some countries, and the disparity between urban and rural, the poorest and the wealthiest, has grown. And along the way, we lost that message with averages, and we're getting that very wrong at the moment. Health systems is how we run the healthcare, but that's not how we do projections. So we simplify it. Yes, Excel is very prevalent in this area, and simulation dynamics, the whole kind of black box effect is also very prevalent in this area. So somewhere along the lines, we're kind of trying out all these different things, and it's not working. And I think that we lost some of the reasons why we're doing this. And the journey on this, for us, has been about where does policy fit in? Why are we doing this? And that's partly why it's a message back to data modelers and analysts. When we start this journey, we always think it's about the numbers, get it right, put it through the model, and get it out. But actually, for workforce planning, as we've experienced it, or I've seen it run through the last decade, we lost the policy story along the way. But actually, if you don't stop there, you look at why we're doing workforce planning, we're doing it to have an impact. And therefore, if you want impact in this area, you need collaboration. So not only is it about policy development, it's about getting messages to all the people who need to come together. This is not a government issue, necessarily. This can be a private sector issue, this can be a university issue, this can be about big players who need to make a difference for 2 years' time, 5 years' time, 10 years' time. And then we have to remember why we started this process in the first place. So, as modelers, we have to think wider and think, who exactly are we doing this for? And I think it's not our client. It's for the people that we're trying to treat in the future. So, from our work, there are a few messages that have come out. And that is that modelers and analysts have to be responsive. And the user of the message, needs to be at the front of what we're doing. And when we talk here about any other system that we want to implement, is it actually appropriate for them? So one of the work we've done with Sudan and the team there in the ministry and the World Health Organization is to look at what we can develop as a tool that they can use when they are making these policy decisions, when they're having these conversations, getting all the stakeholders around the table. That's not unusual in global development. it's very usual to get all the stakeholders around the table, and then we talk in a qualitative way about the data, and then we talk about the numbers that come out of a spreadsheet and sits in a report as a table, but we don't get to mess with it. So one of the areas we've looked at is how do you take something like Excel that everyone wants to use and knows to use. So as much as I looked at every other tool you could throw at them, Excel came out as a favorite. They all said, give us something that we can read in Excel. So what we've developed is a tool where they can upload their Excel, they can customize it to whatever they need it to, geographically break it down in terms of gender, whatever it is they need to break it down to. The analysis is then done online when they upload the data, and then they can download it back in Excel to go away and do what they need to. That to us at the moment is a pilot, and that is what I mean by user-orientated. It's listening to them, giving them something that they can play with, go away, analyze, come back, interact, and keep going with this process. And then thinking about behaviors and decisions when this is taking place. So one of the areas I said about averages is a massive issue for workforce planning. Uncertainty is a massive issue for workforce planning. This tool is about, the tool we've developed, they can put lots and lots and lots of Excel spreadsheets up, but be able to manage that in the online environment rather than losing it along the way. So one of the things they can do, for example, is one country might break it up in terms of urban-rural, another country might break it up, and this does happen across the world in terms of workforce, is that we love our capital cities and that's where we want to work, or the next bigger city and the next bigger city. And this effect can be seen all over the world. So one of the areas we looked at is how do you break it up geographically if you didn't break it up as urban-rural. So again, creating the flexibility for teams to be able to do that. And then the communication at the very end is something that we're working on at the moment. So this takes care of some of the issues to do with what happens at the beginning. What we want to see happening at the end is the message gets communicated through visualizations, through the type of issues that have already been talked about. The tools are out there, but by bringing it online, bringing this conversation online, we can start to make a difference in terms of this issue of communication back to individuals and teams and companies that need to collaborate to make this happen. And the last point there in terms of open source is, it seems minor, and in this environment, it's something that we all accept. But actually, if you think about who makes workforce planning happen, makes these activities happen, it's governments or the donor organizations. At this point in time, they don't understand open source enough. When these tools are developed, there are a lot of contracting issues that stop it being open source to begin with. And then there are a lot of issues to do with data that stop it being open source. And we have a long way to go. So as much as you can talk about the future is here in some areas and you know, we're still working in the past in other areas, this is very true for workforce planning. Open source is not a terminology everyone understands and wants to get involved in or knows how to get involved in. We've tried to make a start. The basis of the tool is a Creative Commons program, but getting that message out and getting it to the users as open source will be a few years away unless someone makes a real difference in this area very, very soon as a funder of the tool. So if I bring it back to the issue of big data, small data, I put it to you that actually it doesn't have to be big data to be a big issue. Small data makes a lot of impact, and we do have to work a lot harder to get this right for mixing numbers and policy. Thank you.